So I know we're going to get into a couple specific examples in a moment, but maybe before we do that, this concept of, quote, community. Community can mean a lot of different things. I mean, there's civic organizations, there are individual citizens, there are groups, different municipalities and different sort of levels of government, so forth and so on. Are there particular constituents or groups or individuals that you think about when you think about community-based or community-engaged research?
That's a great question. And community absolutely can mean many different groups of individuals. Really, in my mind, community is a population that could benefit from the work that a researcher is doing. So for some research that's being done in the clinical setting, the community might be primary care physicians who are practicing outside of an academic medical center. Community in another setting for a public health intervention might mean the actual neighborhood in which the intervention or the research plan will take place. So it really can be a very varied population. Another group that we work a lot with are actually patients. So bringing the people that are impacted by the clinical research most to the table to have their voices heard too.
Imagine that, actually, involving patients in research.
When you say it out loud, it sounds like such a no-brainer. It absolutely does, but this is, and certainly this work has been going on for a very long time, but it really hasn't been brought to the forefront in this area until the last couple of decades.
Yeah. So, as a researcher, I know often when I talk to non-researchers, which is the majority of the population, right, that we typically interact with outside of our jobs, people don't quite always get what we do, sort of what research is, the science behind it, methodology. We tend to talk in a vernacular that is very different than sort of day-to-day vernacular. So I guess the question is for community partners to be, quote, engaged, all the potential partners that you just mentioned, patients, community organizations, so forth and so on. Are there any barriers that have to be overcome in terms of how we translate sort of the talk and the activity of scientists, with those who are non-scientists on a day-to-day basis? Anything in your experience that needs to happen to be able to kind of bridge that gap between the two parties?
Yes, there absolutely are barriers to community engaged research, and that's one thing through the CTSI Community Engaged Research Corps that we've been working hard to try to develop in terms of resources that can help investigators with this. As a primary care physician, I'm very used to talking to patients about health and translating all of the vernacular that we learn in medical school into something that makes sense to the patient who's sitting in front of me. And we really have to take that same exact approach when we move forward with talking about our research with the community, with whatever that community might look like. So some of the very straightforward first steps are establishing that relationship and providing education for the community partner or community group that the researcher is working with to make sure that everyone's on the same page. And this doesn't mean turning them into mini researchers. Certainly they're being brought because they have a viewpoint that's so valuable to researchers, but we have to be able to speak the same language in order to communicate effectively. So really making sure that researchers use language that's very community facing, and for the community, helping them to understand the basics of the research design so that they feel empowered to be able to give their thoughts and in a free fashion.